Good afternoon, Kahnawà. Thank you for joining us on another update from the COVID task force. We did have a task force meeting this afternoon, and quite a lengthy meeting. So we have a fair amount of information to share with you this afternoon, and some of it obviously is ongoing. If anything that we have learned in the past several weeks with the Omicron variant and the fast spread, that things are changing very rapidly, and things will change substantially over a very short period of time, and I'll update you on that in just a moment. Well, first thing I wanted to do is let you know that the Vaccination Centre, after discussion with people over at the Super Bingo, starting Monday, we will be moving the operations over to the Super Bingo once again, like we did earlier this year, so that we could maximize the space, maximize the number of vaccinations given out to the community. So people wanting the booster shots or first or second doses, will have an opportunity to get it done as quickly as possible. So we're very pleased to have that arrangement, and we'll be rolling that out, and a release will be going out very soon with the exact dates, but certainly we know for sure it's going to be Monday, starting at 1 p.m. till 5, Tuesday from 9 to 5 p.m., and then a further schedule throughout the week will be issued very shortly. So again, we think it is extremely important for people to take advantage of the opportunity to get vaccinated or boosted right here in our community, and we're providing that opportunity for everybody to do so. On another part of our discussion this afternoon, we talked a lot about the current measures that are in place, and looking at, again, trying to find a balance and make decisions accordingly. There was some questions and some discussion regarding the personal care services that are currently closed within the community. And if that's something that could be reconsidered. So personal care, such as massage, gyms, hairdressers, and things of that nature. Again, then after looking at it again, we did look at the possibility of them opening sooner than than previously established. So there will be more information going out to them on Monday on safety precautions that need to be taken and put into place, with the hopes of having them reopening early next week. So again, more information to come on that, and those businesses who are directly impacted will have somebody reaching out to them directly. Because as we said, our goal was to lessen the impacts on the community as much as we possibly can, and if we feel confident and safe in making a decision, we will go ahead and do so. Mind you, keeping in mind that everything we do in terms of outside your household and any action we take, more contacts and such, there's always the increased risk of transmission of the virus. However, we also have to try our best to find ways to adapt our lifestyles to accommodate it. And that kind of leads me right into the next point. And a release had went out just a little while ago explaining about new PCR testing priorities, as well as isolation requirements for community members. There has been significant changes made in this area, and it is somewhat of a turning point in the way that we are addressing the pandemic. And this is obviously something we looked at very closely, or public health looked at very closely, and determined it's the right step to do, and it's also the way that it's going to be addressed throughout the entire province moving forward. And basically what this does is it puts a lot of the full responsibility on individuals to determine the next steps in terms of case management if you do have COVID-19. So it will be on individual community members to make that determination. So these new priorities will come into effect immediately. So what this means is twofold. One, regarding testing. Testing of the PCR testing will no longer be available for general population. This means if you have, COVID-related symptoms, or you have COVID-related symptoms, or you do have a positive test on a rapid test, you no longer have access to a PCR testing. Because now we're seeing with the amount of Omicron and amount of cases that's happening in and around the community that it's nearly it's very, very difficult to keep track, and you're seeing with the high positivity rate of cases that if somebody does have symptoms, you could assume that you do have COVID and govern yourself accordingly, and I'll talk about that in just a minute. Or if you do have a positive rapid test, and then you can consider that a positive case. Because the testing site will only be available for essential and high-risk locations, or also somebody who has been directed to by public health. And you can also access the PCR testing if you are somebody who needs to be admitted to hospital for surgery, and you have to have a negative test prior to entry. So there are still testing that will take place, but it's for a very specific group. So if you do have COVID symptoms, if you do have a positive rapid test, you could assume that you do have COVID-19, and you could, I guess it's self-management or case management. So if you do have COVID-related symptoms and or have a positive rapid test, and you are somebody who is vaccinated, meaning 2 or more vaccinations at this point in time, you are to isolate for 5 days. On day 5, if you no longer have symptoms, or your symptoms are lessening, and you have not had a fever within the past 24 hours, you are released from isolation. But for the next 5 days, you have to continue to monitoring yourself closely. Continuously wear a medical grade mask, maintain strict distancing measures of 2 meters, certainly avoid all vulnerable people. And if you are returning to work, you must work away from all others and not share any common spaces. If you have COVID-related symptoms, and you test positive on a rapid test, and you are not vaccinated or not fully vaccinated, meaning you only had one vaccine, the isolation period is at 10 days and remains at 10 days. So the difference between the isolation period is because of what the evidence has shown is that people who have been vaccinated and do contract the Omicron virus, that your contagious period for a vaccinated person versus unvaccinated is reduced, so that people could recover quickly and become contagious much more quicker than those who are unvaccinated. So therefore, the period of isolation can be reduced. And if you are in contact with a person who is positive, that's again a lot of things we heard a lot of recently about contacts, and contacts are defined as a high risk, a moderate risk, and a low risk. And a high risk contact would be anybody who is living in your household, or anybody who is a intimate or sexual partner. It would be considered a high risk contact. A moderate risk would be a contact of more than 15 minutes within less than 2 meters, where one of the 2 people were not wearing a mask. So if you're within 15 minutes, 2 meters apart, where 2 people are not wearing masks, or only one person wearing a mask, you are considered to be a moderate risk. And any low risk is considered anybody contact more than 15 minutes, less than 2 meters, but both people are wearing a mask. Also, the terminology adequately vaccinated is for those who have received 2 or more doses of a recognized COVID-19 vaccine. So if you are in contact with a positive case, and it is a high risk or a high contact, high risk contact, and you are adequately vaccinated, you still must isolate for a period of 5 days. If there is no symptoms after 5 days, you could be released from isolation. But again, for the next 5 days, from day 5 to 10, you should monitor yourself very closely. And if you do develop any symptoms, and then you would have to return back to isolation and isolate yourself for another period of 5 days, if you follow the case management document that's been released. If you are in contact with a high risk contact, if you are somebody who is not isolated, and not vaccinated, you must isolate for a period of 10 days. And then a moderate risk contact, somebody who is adequately vaccinated. So if it's only a moderate level risk, you must monitor yourself for symptoms for 10 days. You must wear a mask continuously, maintain distancing, stay away from vulnerable people. But there is no isolation required. However, if you are at moderate risk and somebody who is vaccinated, you must isolate for a period of 10 days. Anybody who's deemed to be at low risk, whether you're vaccinated or not, you should certainly monitor yourself for symptoms and follow regular public health measures. And if you do become symptomatic, and then put yourself into isolation. So there is this document that's out there. You could refer to it, and this will be available on all mediums as well. But we want to give a first introduction to it here today, because it is a substantial change in the way we're moving forward. We're somewhat in a transitional mode in terms of management of the pandemic. Put in more responsibility on individuals, because the systems that are out there can't. The capacity is maxed out, and the testing capacity is maxed out. So now, again, through a cooperation of everybody, we could ride out this fifth wave in the best possible way. So this is one step, and again, it's a transition that moving towards what they call an endemic. Where we're in a pandemic now. We're not in an endemic yet, where endemic is when we learn to live with the virus and adjust our lives accordingly. This is one more step in that process, and this is a big step in that process where, again, we're looking towards the support of the entire population in order for us to manage that moving forward. So that again is important information, and more information will be forthcoming as required on this. But it's also important to note. I know a lot of questions were asked about rapid tests. There was obviously the distribution given to the community a couple weeks ago, where everybody had an opportunity to have a box of tests. We are in the process of trying to get more tests for the community. We're expecting those, but we don't have a timeline as we speak yet. And as well as I'm sure if you watch the news that you see across the country, there is a shortage of tests, but we are in the process of acquiring some, and we'll obviously keep you up to date on that. But again, with or without a rapid test, if you do develop symptoms of COVID-19, you could assume that you are positive and govern yourself accordingly in terms of isolation and such. Yes, on a last note, I wanted to address a topic that I'm sure is on the front and center of many people's minds, and has been a big source of information in media as well as on Facebook regarding one of our task force members, Lisa Westaway, and her decision to travel. There was a lengthy discussion that took place at the task force this afternoon, and it was decided that it was important that we do say something. So, just to back up a tad, the task force, since we've been in the recovery phase, and even when the state of emergency was redeclared in December, a lot of what we've been doing was making recommendations to community rather than making directives. Again, trying to keep the responsibility on individuals to make choices for themselves based on their own level of risk that they feel comfortable with. So that's why much of the information that we have put out there, such as information on gatherings, visitation over the holiday period, and travel and stuff, again, were all recommendations in which we put forward, knowing that a lot of people had plans already for various holiday gatherings, holiday travel and such. Yeah, we had to make some tough decisions prior to the holidays and during the holiday period as a task force, and we had to unfortunately close some businesses, and we had to make those tough calls, and we will continue to do so. But as you've seen with the information regarding the personal care services, we're trying to minimize that risk, that closures as much as possible. In this case, Lisa did decide to put her family first, and after working very long hours for a very long period of time, she felt it is important that she takes the time, to spend with her family. And this has not gone against any directives. She understood the risks, and like many others, she made the personal choice to do what. She made the personal decision to travel, knowing the risks. And that again is not something that was a directive, and people could disagree, with task force decisions. It's anybody's right to disagree, and you may disagree, and certainly may even be critical of her decision to travel with her family. However, and it has to be said, but nobody deserves the treatment and the bashing in which she put up with for the past 48 hours, for her and her family. To be treated like you're a nobody, to be treated like you're the community's punching bag. You're there for some people's personal entertainment, and seeing who could bash more than the next person. Circulating memes on people, Photoshop naked pictures of somebody. It may be funny to some, but if you're the victim of that's certainly not funny at all, and nobody deserves that. And I wonder how low will some people go. To see hateful, disgusting comments and hearing about threats on personal safety, again, is 100% unacceptable. She has done nothing but assisted this community and given her heart and soul for the past almost 2 years, guiding public health and providing input to the task force. And she's also, a wife, a mother, and a trusted colleague for many people. So it's very disheartening to see this type of reaction. I know her board of directors is going to be saying something very shortly, but as a task force, after again discussion, and for some time, there was unanimous support that was given to her this afternoon. And also unanimous that we felt it was very important for us to condemn the way certain individuals have been reacting. We're all stressed, we're all part of this whole pandemic, you know, that we've been dealing with, and everybody wants it to end. But certainly turning on each other is not going to help. With that, I thank you very much, and good evening.